The rotator cuff is a group of tendons that wrap around the top of the upper arm bone at the shoulder joint and hold the ball in its socket. A tear causes pain on the outer shoulder and upper arm and weakness when you reach or lift. It can come on slowly with wear over the years or suddenly after a fall or a heavy pull. Many people find the pain is worst at night, and that lying on that side wakes them. Reaching overhead for a high shelf or when hanging laundry often brings it on. Not every tear needs surgery, and many shoulders do well without it. Physiotherapy strengthens the muscles around the shoulder, so they share the load and ease the pain. Anti-inflammatory medication, and sometimes a cortisone injection, can settle a painful flare. Adjusting how you do overhead tasks gives the tendons a chance to calm down. If the shoulder stays strong and comfortable enough, this may be all that is needed. When a tear is large or the weakness and pain persist, the tendon can be repaired. It is keyhole surgery, done through small incisions as an overnight procedure. The torn tendon is brought back to its place on the bone and held there with small anchors while it heals. Any rough or worn tissue is tidied up at the same time. You go home the next day with the arm supported in a sling. Recovery is steady and asks for a little patience because tendon healing to bone takes time. The arm rests in a sling for the first few weeks to protect the repair, and you will not be able to drive while it is on. Physiotherapy moves through stages: gentle movement first, then active movement and strengthening later on. Most people are using the hand for light tasks early, with fuller strength returning over several months. Following the program closely gives the tendon the best chance to heal.